Teenagers are also hit hard in our nation's fentanyl crisis. In the past 3 years, teen overdose deaths have doubled in the United States. According to JAMA Pediatrics, fentanyl-related deaths in children were 30 times greater in 2021 compared to 8 years earlier. New research shows teenagers lack access to addiction medication that could help them. Our next guest understands the importance of talking about the dangers of fentanyl and drugs with your children. He lost one child to an overdose and nearly lost a second. Joining us is David Magee. He is the creator and director of the William Magee Institute for Student Wellbeing at the University of Mississippi. He is also a best-selling author of the book, well, it's out today, Things Have Changed. He's the best-selling author of Dear William. The book out today is Things Have Changed, What Every Parent and Educator Should Know About the Student Mental Health Substance Misuse Crisis. David, always great to talk to you.
Thank you so much.
Good to have you on the show. Those numbers, the overdose numbers, doubled for teenagers. Yeah. What is happening in this country?
Well, I mean, we have an epidemic. I mean, it's like sharks are running everywhere. And when teens are dying in the numbers they're dying at today, we have to sound an alarm across this country. Parents, educators, churches, all stakeholders in the student ecosystem to say, what do we need to do about this? How do we reach them?
It's interesting because the use of drugs and alcohol by teenagers is down, and yet deaths are up, which means that a greater percentage of the smaller number of kids who are taking ecstasy or a Percocet or some sort of pill are dying because it's fentanyl laced.
Yeah, nowadays students have learned in their mind that taking a pill that they didn't get prescribed to them from the doctor is okay. It's just that there's not enough supply to meet their demand. So if they're buying, they'll call it Adderall, Percocet, Xanax. But these are, if they're buying it not from their doctor, they're buying it from a drug dealer or a fellow student, it's counterfeit. And usually it has fentanyl in it. And so they don't even know they're seeking fentanyl. They usually end up there trying to self-medicate.
You wrote in a recent article that, make no mistake, fentanyl is in your backyard, and shockingly, it's not just in your high schools, it's now in the hands of your 6th, 7th, and 8th graders. How are 11 and 12-year-olds getting these pills?
Well, I asked a student, I said, how do you get this? They said, well, my friend said this was his sister's pill. That's a common theme. And also, drug dealers are already operating in schools selling marijuana to 12, 13-year-olds. It's those dealers often that are also selling these pills. And they call them by the name, but that's not what they are. Just about every community in this country is littered with these counterfeit pills, and most all of them have fentanyl in it.
So what are we supposed to do, and how early are we supposed to start? I mean, listen, if I had $1 for every time a parent said to a kid, don't do that, and then the teenager goes out and does that.
Right.
But so what as a parent should you do, and how young should the child be when you start having these conversations?
Number one advice I give to parents is, and I learned this the hard way, talk to your student with open-ended questions. Talk to your teenager in open-ended questions. Don't be telling them how they should feel and what they should do or make assumptions. Ask them open-ended questions, and in time, you'll get answers that maybe they don't even know. Number two, you have to talk about the reality that they can't take pills that aren't prescribed to them.
Ever.
The risk is too high. And look, the deaths are soaring, but also what I'm seeing a lot of what I call it the walking dead, where they're on the drug, and I'll see students try to white knuckle their way out of it because we don't have the education and support system in place that they even know what they're dealing with.
Yeah, and it's all, of course, inextricably linked with the mental health crisis that we keep hearing about. And I mean, they're sounding the alarms everywhere. Why aren't more kids getting help with the anxiety and depression?
I think one thing we have to understand in this country, look, this is America. We have to remember that. A lot is there is some good work being done. It's in silos. We have to break those silos and begin to talk about everywhere in the student ecosystem the type of education we need to give them. We learned to push math down into middle school, algebra. It's time that we push in the education that teaches them how they manage their own feelings, about their mind and their thoughts that begin at puberty usually, because Most students who end up on fentanyl, they're starting out just trying to self-medicate. It's not peer pressure, it's self-medication.
It's not peer pressure, so
It's not peer
interesting.
pressure.
You have a center at the University of Mississippi dedicated to your son, William, who you lost to a drug overdose. You know this is a path you've walked.
Yes. My sweet William, he was an honors college student. He was a track athlete at Ole Miss. And he told me, I kept trying to warn him, and he thought he could quit and walk away. And soon after graduation, he was getting treatment, making progress, but he died of an accidental overdose. But I tell everybody, don't feel sorry for us, because we have another son who nearly died, Hudson, and he is now 11 years sober. And help works. You just have to have it earlier the better, you know, and it takes a village of support, and it really takes talking about it and acknowledging the problem. It will not fix itself.
Thanks so much for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.